Imagine taking a pill every single day because you believe it's protecting your health, only to discover later that the very same pill might quietly be increasing your risk of a heart attack or a stroke. It sounds shocking, but cardiologists around the world are warning that some medications commonly used by older adults may have hidden dangers, especially when taken for long periods of time or without proper medical supervision. Now, before we go any further, let me be very clear about something. This video is not telling you to suddenly stop taking any medication prescribed by your doctor. Medications save lives, and many people truly need them. But what cardiologists want people to understand, especially those over the age of 60, is that certain pills can place extra stress on the heart and blood vessels if they're used incorrectly, taken unnecessarily, or combined with other medications. And here's the reality. As we age, our bodies change. The liver processes drugs more slowly, the kidneys filter toxins less efficiently, blood vessels become more fragile, and the heart itself has to work harder to pump blood throughout the body. That means medications that were once perfectly safe at a younger age can begin to behave very differently in older adults. This is exactly why cardiologists are sounding the alarm about several types of pills that millions of elderly people take every single day, often without realizing they could be increasing the risk of serious cardiovascular problems. So in this video, we're going to talk about 5 types of pills that cardiologists say may raise the risk of heart attacks or strokes in older adults, why they can become dangerous over time, and what safer alternatives doctors often recommend instead. The first type of pill might surprise you because it's something many people consider completely harmless. These are common painkillers known as non-steroidal anti-inflammatory drugs, or NSAIDs. These include medications like ibuprofen and naproxen, which people often take for arthritis, back pain, headaches, or general aches and pains. For many younger adults, these medications can be helpful when used occasionally, but in older adults, regular use can create serious problems for the heart. Here's why. NSAIDs work by blocking certain chemicals in the body that cause inflammation and pain. But those same chemicals also help regulate blood flow to the kidneys and maintain healthy blood vessel function. When these chemicals are blocked repeatedly, the body may begin retaining more sodium and fluid. This can increase blood pressure and place extra strain on the heart. Several major studies have shown that long-term use of NSAIDs is associated with an increased risk of heart attack and stroke, especially in people who already have high blood pressure or cardiovascular disease. And the risk becomes even greater for older adults because their blood vessels are already less flexible and more prone to blockage. When blood pressure rises or blood flow changes suddenly, the heart has to work harder, and that can sometimes trigger serious cardiovascular events. Another hidden danger is that NSAIDs can interfere with certain heart medications, including blood pressure drugs and blood thinners. This interaction can reduce the effectiveness of those medications and increase the likelihood of dangerous complications. That's why many cardiologists recommend that older adults avoid using these painkillers regularly unless a doctor specifically says it's safe. In many cases, safer options like physical therapy, gentle exercise, heat therapy, or carefully monitored medications may be better choices for managing chronic pain. Now let's talk about the second type of pill that cardiologists are increasingly concerned about: certain sleep medications. Sleep problems are extremely common in older adults. Many people struggle with insomnia, frequent awakenings during the night, or difficulty falling asleep. As a result, sleep medications are often prescribed to help people get the rest they need. But some of these medications can have unexpected effects on the cardiovascular system. Certain sedative sleeping pills can slow down breathing, reduce oxygen levels during sleep, and disrupt the body's natural rhythm that controls heart rate and blood pressure. In some cases, these medications can also cause dizziness, confusion, or sudden drops in blood pressure, which may lead to falls. And while falls might not sound like a heart problem, they can trigger stress responses in the body that increase cardiovascular strain. Even more concerning, some sleep medications have been linked to irregular heart rhythms in older adults. When the heart's electrical system becomes unstable, it can increase the risk of both stroke and heart attack. Many cardiologists now recommend addressing sleep problems by focusing first on natural solutions whenever possible, improving sleep habits, reducing caffeine, Maintaining a consistent bedtime routine and getting regular sunlight exposure during the day can significantly improve sleep quality without the risks associated with certain medications. If medication is needed, doctors may recommend options that have a safer profile for older adults and are used for shorter periods of time. Now, the third type of pill is something that millions of older adults take daily to manage digestive issues. These are medications used to treat acid reflux and heartburn. Acid reflux medications have become incredibly popular over the past 2 decades. Many people take them for years without thinking twice. But some research suggests that long-term use of certain acid-suppressing medications may have unexpected effects on the cardiovascular system. These medications work by reducing the amount of acid produced in the stomach. While that can relieve heartburn, it may also affect the body's ability to absorb certain nutrients, including magnesium and vitamin B12. Low magnesium levels in particular can affect the heart's electrical activity and may contribute to irregular heart rhythms in some individuals. In addition, some studies have suggested that long-term use of certain acid reflux medications may influence the health of blood vessels by interfering with compounds that help maintain healthy circulation. While the research is still evolving, many doctors now recommend using these medications only when truly necessary and for the shortest possible duration. Lifestyle changes such as eating smaller meals, avoiding late-night eating, losing excess weight, and reducing trigger foods can often control reflux symptoms without long-term medication. The fourth type of pill is one that many older adults take for anxiety or muscle relaxation. These medications belong to a group called benzodiazepines. These drugs are sometimes prescribed for anxiety, panic attacks, insomnia, or muscle spasms. They can be effective in the short term, but long-term use can create serious risks for older adults. Benzodiazepines can slow down the central nervous system, which affects breathing, blood pressure, and heart rate. In older adults, the body processes these medications much more slowly, meaning they can stay in the system longer and accumulate over time. This can lead to excessive sedation, confusion, poor coordination, and an increased risk of falls. But the cardiovascular concerns go even deeper. Some research suggests that long-term use of these medications may contribute to changes in blood pressure regulation and increased risk of cardiovascular events in certain populations. Another issue is that these medications can interact with other drugs commonly prescribed to older adults, including heart medications and antidepressants. When multiple medications interact, the effects on the heart can become unpredictable. Because of these risks, many doctors now recommend limiting the use of benzodiazepines in elderly patients and exploring safer alternatives such as cognitive behavioral therapy for anxiety or non-sedating medications when necessary. Finally, the fifth type of pill that cardiologists often warn about is certain over-the-counter cold and flu medications. When people feel sick with a cold or sinus infection, they often reach for combination medicines that promise quick relief. But many of these medications contain ingredients called decongestants. Decongestants work by narrowing blood vessels in the nose to reduce swelling and congestion. While that can help you breathe more easily, it also causes blood vessels throughout the body to constrict. This can raise blood pressure and increase heart rate, two things that can be dangerous for older adults, especially those with heart disease, high blood pressure, or a history of stroke. For someone with a healthy cardiovascular system, this temporary effect may not cause major problems. But for elderly individuals with fragile blood vessels or existing heart conditions, the sudden increase in blood pressure can sometimes trigger serious complications. That's why many cardiologists advise older adults to read medication labels carefully and consult a healthcare professional before using cold and flu medicines containing decongestants. Safer alternatives may include saline nasal sprays, steam inhalation, staying well hydrated, and using medications that do not contain stimulants affecting blood pressure. Now, hearing all of this might sound alarming, but the goal here is not to create fear. The goal is awareness. Medications can be incredibly helpful, and in many cases, they are absolutely necessary. But the key is making sure they are used wisely, especially as we get older. One of the most important things older adults can do is regularly review all of their medications with a doctor or pharmacist. This process is sometimes called a medication review, and it allows healthcare professionals to evaluate whether each medication is still necessary, whether the dosage is appropriate, and whether there may be safer alternatives available. It's also important to remember that the more medications someone takes, the greater the chance of interactions between them. Even over-the-counter pills, herbal supplements, and vitamins can sometimes interact with prescription drugs in ways that affect the heart. Staying informed, asking questions, and maintaining open communication with healthcare providers can significantly reduce these risks. Another powerful step is focusing on lifestyle habits that protect the heart naturally. Regular physical activity, balanced nutrition, maintaining a healthy weight, managing stress, and getting quality sleep all play major roles in reducing the risk of heart attack and stroke. In many cases, improving these lifestyle factors can reduce the need for certain medications altogether. So if you or someone you love is over the age of 60 and taking multiple medications, this is a good time to have a conversation with a healthcare professional about whether everything being taken is still necessary and safe. Sometimes a simple adjustment can make a huge difference. And remember, knowledge is one of the most powerful tools for protecting your health. Understanding how medications affect the body, especially the heart, can help you make smarter decisions and avoid risks that many people never even realize exist. If you found this information helpful, take a moment to share it with a friend or family member who might benefit from hearing it. Many older adults take these medications without ever knowing the potential risks, and awareness could help someone avoid a serious health problem in the future. Your heart works for you every second of every day. Taking the time to understand what helps it and what might harm it is one of the most important investments you can make in your long-term health.